Hi, I'm Bob Garner. Any of you who have ever seen me on TV reviewing restaurants know that I love to eat, and it will come as no surprise to you that I love a good donut. I would like them even better without the hole. But you know, the hole in this donut is a pretty good representation of a major problem we have in healthcare today. And I'm not talking about eating too many donuts, although that could be a problem too. No, what I'm referring to is a gap in coverage for prescription drugs for those in Medicare, commonly known as the donut hole. Without my getting into too much detail here, suffice it to say that almost 3.5 million people on Medicare run out of insurance coverage for their prescription drugs each year, which is often called falling into the donut hole. At that point, they have to start paying 100% of their prescription drug costs, even though they still have to keep paying their prescription drug insurance premiums. In North Carolina, 30% of Medicare beneficiaries reach the coverage limit each year. Nationally, only 15% of those who fall into the donut hole ever come out the other side and qualify for catastrophic coverage. They just sort of get stuck there in the middle of the donut. What's worse, the coverage gap keeps growing and prescription drug costs keep climbing. And of course, higher costs cause people to either skip their doses or do away with their prescriptions entirely. And of course, that can put their health at risk or create other long-term costs. AARP is working with leaders in Congress not only to close the prescription drug donut hole, but also to bring more generic drugs to market, especially generic versions of the very high-cost biological drugs which are used to treat serious diseases like cancer and MS. Right now, there are no generic versions of those drugs. We need your help. Sign up by visiting our new website, www.healthactionnow.org. For more details on this and AARP's other health reform proposals, visit www.aarp.org/governmentwatch. Let's keep the recipe for healthcare a little easier to swallow.